Hi there. I'm Dr. Samantha, the maternity mentor, and welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is your chance and my chance to interact with each other live. I will answer any questions that you might have. Just please put them into the chat and we'll get to them as we see them. Remember, we are also on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description. Please follow us over there and share the channel with your friends and family. If you can, please subscribe to the channel. It really, really helps me out. So I would really appreciate that. And remember to hit the notifications button so you can get notified of our latest content. And before the end of the live today, I'm going to give you a sneak peek as to what to expect from our latest video. So one of the things we do is we also answer questions that you guys have put onto the videos. So I'm going to go ahead and start with some of those questions, but please feel free to put your questions into the chat. Now, every week we always get a lot of questions about bleeding, which is why we've done several videos on it, including the latest video, which talks about the colors of blood. So the first question that we had was, I'm 7 weeks pregnant and I'm spotting very light brownish every other day. I have to travel near my 10th week of pregnancy by air. Is it safe? So this is a great question. So this goes to a whole different type of kind of thought process when it comes to, honestly, to bleeding as well as pregnancy complications. What is safe travel? So the first thing I need to say to this particular viewer and to any of you guys is ultimately the decision on whether it's safe for you to travel lies with your healthcare provider because they know your individual situation, so they understand what's going on with you. But travel is a very unique situation. So starting with bleeding, when you're talking about bleeding, it is possible that you're having a miscarriage. You could also be having a variety of other complications like a subchorionic hemorrhage. And we have a video on that. We can link that into the description. So when you're having a complication like bleeding, it's very important that you're close by to a healthcare provider that can help you out. Now, in this case, this viewer, 7 weeks pregnant, planning to travel at 10 weeks pregnant, is very early on. If there was an outcome that was not good, it's a miscarriage, which would be unfortunate. Is there any specific risk to having a miscarriage by flying? There's none that we know of. However, there's a lot of controversy over whether the pressure changes that happen and the pressurized cabin contribute to any kind of healthcare issues. But now air travel comes with its own set of issues, and that's involving the risk of blood clots. When you are a pregnant mom, you're at a higher risk for developing blood clots. That's because you have more of the clotting factors in your system, and this is to help prevent you from hemorrhaging at birth. So those clotting factors put you at increased risk for blood clots when you're taking a long flight, which is why they want you to get up and walk around. Additionally, when you're taking long car rides, you're supposed to go ahead and you're supposed to walk every 2 hours for about 5 to 10 minutes to reduce this risk. So this is one of many things that you want to take into account when you're traveling. Another thing you guys should consider is that moms who are pregnant are considered immunocompromised. So that means if you're traveling into an area that might have some illness that's going on in the community, it may be like a better idea to stay at home and not to travel because you would be at a higher risk of developing these diseases or conditions, which might put your pregnancy at risk. The other thing is that travel is stressful on a body. No matter what we try to do, no matter where we're going, the logistics of traveling, almost always you take an entire day to get to where you're going by the time you're talking about when you're packing and getting ready and traveling to an airport and going on the airplane and all that stuff, right? We don't eat right, we don't sleep right, we don't drink enough. And as a result, this can cause a lot of stress on bodies. For women who are taking a vacation, as much as vacations sound like they're awesome and fun, a lot of those vacations also come with some stress. And I can tell you that throughout my career, I have taken care of many women who are on their baby moon and they end up going into preterm labor and deliver their baby in a completely different state, which is extremely stressful on a family. So if you have to travel for like work, it's definitely something that you need to just figure out how you can do it and if it's safe by talking to your healthcare provider. If you're talking about traveling for pleasure, I recommend you stay at home or close to home as you can. Do staycations, get to know your own area, because these are the actual safer where you can stay in your community, stay near your hospital, and stay near your provider should you have any type of complication. Back to this mom who is 7 weeks pregnant, you got to ask your healthcare provider about travel, because ultimately there's a lot more to it than just a little bit of old brownish blood. So I see we have a couple questions in the chat, which is awesome. Hi, Kyle. I was just wondering if it's okay if a mom is 40 weeks pregnant. So it is okay that you are 40 weeks pregnant. So normal pregnancy is 40 weeks long. So at 40 weeks, you are considered to have reached term. At that point, we do start to monitor moms a little bit more closely because we want to make sure babies are doing okay. So oftentimes they'll have you come in for non-stress tests, which we have a video on. We can link that into the description. And this is like a little test to see how well your baby's doing inside the belly. Really, up until 40 weeks and 6 days, a mom should be doing well. If she's having no complications, baby's moving well, it's fine. Now, at 41 weeks, that's when we start to have a little bit of concern, and we will talk about an induction. The reason for that is that once you are truly 41 weeks, there becomes a higher risk of a stillbirth. This is because now your placenta is getting old. And when the placenta starts to get old, one of the things it does is it calcifies or hardens in places. Now, remember, the placenta is the organ that's attached to the side. You have your uterus, it's attached to the side of the uterine wall. And all of this is blood vessels that are feeding the baby and taking out toxins from the baby, right? So when this starts to calcify, not only are those blood vessels like closing off, but also it's kind of weakening this attachment that you have here, which could cause a uterine abruption. So once we're at 41 weeks, we really want to start taking seriously what we're going to do to deliver the baby. It doesn't automatically mean a C-section, but it does mean that we need to work on that. Now, if you're 40 weeks pregnant and everything's been going well, I would ask your healthcare provider if you can use some natural methods to help like potentially start your labor. And we have a video on that. But there's a lot of like very homeopathic techniques for kind of helping get you into a contraction pattern that can be safe for your baby. So I hope that answers your question. Hi, Aiza. I hope I said your name right. I'm diabetic and taking a lot of insulin to manage it. Is that okay for the baby? I'm nervous because I didn't take insulin with my other 2 pregnancies. That is a fantastic question. So one of the things I'm going to tell you guys first is we now pretty much universally use insulin instead of any other medication for diabetes during pregnancy. So when you're diabetic and you're not pregnant, you guys are going to hear about a lot of medications that you can take orally, pills like metformin. It's one of the most common ones, right? The reason why we're no longer using pills like metformin during pregnancy is because they don't work fast enough. We've now determined that diabetes needs to be in very, very strict control to the best of our ability when a woman is pregnant. When the diabetes is like when the sugar is out of control, the baby will start to grow bigger and bigger and bigger. And this means mom is at a higher risk for a C-section. It also means that the baby is at higher risk for having complications of being too large at birth, including having sugar issues, having trouble breathing, and honestly being premature because we can't leave the baby in any longer. Diabetes, when it's left uncontrolled, can also affect the placenta and how well it functions. So we want to make sure that your blood sugar is in the best control possible. The nice thing with insulin is it works fast, okay? Now, there is a lot of monitoring that has to take place, which I'm sure you're figuring out, Asia. We need you to test your blood sugar often. We will give you a long acting and a short acting, and then we need to see the numbers and we adjust. And it's actually normal for your insulin to be adjusted throughout your pregnancy. That's actually a very normal thing. But ultimately, the insulin is the best treatment for your diabetes. It is absolutely the safest, and it's been shown to be the most effective for diabetes and help keeping your baby, like healthy. Now, what happens on the backside? Because a lot of moms are really worried about that. Believe it or not, having a little bit more insulin on board for the baby is not necessarily as bad as having too much sugar. When your baby is used to a lot of sugar, they come out and their sugar crashes, and we oftentimes end up having to give them IV fluids. However, babies who are used to getting the insulin oftentimes will add formula and their sugars will be able to be maintained. So even though it seems like a lot, there's a lot less insulin going to your baby than there is sugar going to your baby. So it truly is actually better. Okay. And for any of you that are prescribed insulin, I do completely encourage you to follow those guidelines. It helps reduce the risk of stillbirth, which is a big issue once you get to about 36 weeks when you are pregnant with a baby and you have diabetes. And for you, Aiza, once you get to about 34 weeks, you want to start making sure you're paying attention to the baby's movements. If you're ever not sure if the baby's moving right, you need to do a kick count. This is where you basically sit down for 20 minutes and you monitor your baby's movements. And if you don't think the baby is moving well, you need to call your healthcare provider immediately, because one of the biggest risks with diabetes that's left out of control or untreated during pregnancy is stillbirth. So, but it's a great thing that you're on insulin, and I really think it's going to be great for your outcome. Okay. For those of you who are joining me, please feel free to ask any questions you want in the chat. I will be more than happy to answer them. So we have another question, which is very interesting. I have a bicornate uterus, and today I completed my 24 weeks. I'm assuming she means 24 weeks pregnant, and she's worried about preterm birth. Okay. So one of the things that really is kind of what is going on is, what is a bicornate uterus? So a bicornate uterus is basically a uterus that breaks into kind of horns like this. It's almost like having two uteruses instead of one uterus. Okay. So with a bicornate uterus, the baby will oftentimes be on one side or the other. And when you have this is a pregnancy complication. It oftentimes will cause a woman to have a lot of infertility issues. When a pregnancy is established, we want to make sure that that mom is being followed by maternal fetal medicine. These are the doctors that handle high-risk pregnancies and pregnancy complications. To answer her question, with a uterine abnormality like this, preterm birth is very much a possibility. The uterus isn't designed, your uterus isn't in the ideal shape to hold a full-term pregnancy. And as the baby gets bigger, right? So if you have these two uteruses and the one uterus is the one that's getting bigger, it's going to push on that other uterus. And it can cause a lot of complications. The biggest thing for you to do, you're at 24 weeks pregnant, okay? So this is a really good age for a baby. Obviously, we don't want you to have your baby at 24 weeks, but at 24 weeks, your baby can live outside of your belly. So if you're having any signs of preterm birth, we can go ahead and we can give you medications like steroids to let the baby's lungs grow, and magnesium to help protect the baby's brain. And so if the baby is born early, we have the right treatments and care to give your baby the best chance. So make sure you're monitoring yourself, make sure you're seeing a high-risk doctor, and make sure you're following all the guidelines that your healthcare provider has given you. The other thing is, when you're pregnant, preterm labor. One of the most common causes of preterm labor is dehydration. So when you're dehydrated, it can cause your uterus to contract, Braxton Hicks contractions. In fact, it's one of the most common causes of Braxton Hicks contractions that develop into a contraction pattern. So it's very important to prevent preterm labor that you're staying well hydrated. And unfortunately for pregnant moms, sometimes we tend to not drink as much because we don't want to pee as much and everybody's peeing all the time. But it really is important that you stay well hydrated. So that can help with that. For any of you who are joining us, please feel free to put your questions into the chat. I'm going to keep answering some of the questions that we have had over the week. So we had a question that was about bilirubin in the urine. So this was on my cholestasis video. So I've had bilirubin in my urine and protein and itching. Can that be cholestasis? So the answer to that is yes, it can be cholestasis. So cholestasis is the slowing or stalling of bile from your liver. And when this happens, you have a buildup of like bilirubin and stuff into your system. And this can cause a lot of issues. It can cause liver failure. It can cause like itching and all sorts of other stuff. It is actually considered kind of like a medical emergency in pregnancy. It's not an emergency that we deliver you right away, but most of the time we will deliver you early. We monitor you very carefully to see how it's progressing. And oftentimes we'll have to have an emergency delivery if things don't go well. So when you have bilirubin in the urine, it turns your urine like very dark, like a dark brown, almost like a really dark ale, like a dark beer. That is a really big sign that you need to get checked out. So if you're having a lot of itching, you see that, if your skin is yellowing, you want to let your healthcare provider know what's going on because they need to check you for this condition because it is serious. Now, there are some other conditions during pregnancy that will also cause some itchiness, but you always want to make sure your healthcare provider knows because usually with cholestasis, we will deliver you at 37 weeks pregnant, which can help relieve the condition. And if you guys have any other questions about that, you can definitely check out the video that we have on that. Now, we had a couple questions about medications that came on the depression video. And the depression video, honestly, is like one of my favorite videos because this is what I do every day. I'm a psychiatric nurse practitioner, and I went into this because I see women struggling during pregnancy and postpartum with a variety of mood issues. And one of the things that happens is we feel like we're not allowed to be medicated because we have these issues. And so I find that it's very, very important that we talk about this stuff. So one of the things, one of the questions was as follows. I'm planning to have a baby and I'm taking Nexito Plus for 3 years and I can't stop. I want to take this medication or an alternative. Is it possible to take this medication during pregnancy? So the answer is yes, I believe. Okay. So this medication, Nexito, is not actually used in the United States. So I have to proviso with the fact that this is not one that I'm going to say I specifically use, right? However, I looked up Nexito, and in our country, the equivalent is Lexapro, escitalopram. So my comments next are going to be on escitalopram. So Lexapro, escitalopram, is safe for use during pregnancy, including the first trimester. Escitalopram has been around for a while. Now, I'll tell you, the one that everybody uses is sertraline or Zoloft. Why? I really can't speak to it. It's a selective serotonin reuptake inhibitor, an SSRI. Lexapro is also that. Now, both of them are well tolerated. I personally think Lexapro has a few less side effects. Like Zoloft tends to potentially make you feel a little bit more numb sometimes if the dosing's too high for you. It just depends on everybody. It also has a few more sexual side effects. Lexapro tends to work a little bit quicker, in my opinion, than Zoloft. Now, that being said, they're both fine. Now, you can take this while you get pregnant. That is possible. So, if this is what helps you feel better, it's important to continue your medication. What a lot of people don't realize is that untreated anxiety and depression can lead to miscarriage, stillbirth, and preterm labor. Okay. This is something that is not really talked about. In fact, untreated depression and anxiety can actually put you at an risk for these. And you also got to understand that just walking down the street, very healthy pregnancy, you have a 2% chance of having birth defects or a miscarriage. Well, actually, having untreated depression makes that risk higher, and treated depression or anxiety makes that risk a little bit lower. Okay, you're lowering your cortisol levels, you're putting your body into a really good state. Now, you always want to get things checked out, and that's why it's important to ask these questions. I had another viewer, which I'm trying to look up, my app is not working, who asked about Vibriad. So she said that I'm sorry, it was the husband. He said that his wife is on Vibriad, vilazodone, and she's 7 weeks along. Is it safe for pregnancy? Okay. So one of the things all of us have is we all have different resources. If you're ever questioning like what you should do about like a medication, you're not sure if your healthcare provider is really disclosing all the risks and benefits and stuff like that, one of your resources can be your your local pharmacist. So pharmacists have specialized training in medication. They understand what is safe and what is not safe for pregnancy. And what happens a lot of times is they are the number one to go to when you're not sure what your healthcare provider is telling you. Okay. Vibriad is often used during pregnancy and postpartum. It's really a great medication. However, there are some risks like everyone else. The biggest risk is usually withdrawal syndrome with it. We don't tend to use Vibriad during pregnancy because it's like not a very commonly used one. So as a result, you don't see a lot of data on it. Now, one of the things the research shows is this. If Vibriad makes you at 100% remission for your depression and anxiety, and say Zoloft, which everybody uses, only puts you at like 10% remission, you want to use the Vibriad. I mean, absolutely, hands down, 100%, because this is what helps you feel better. And what helps you feel better is ultimately the most important thing. What I want you guys to get out of this is that it's okay to get treated for your anxiety and depression. Okay. And if you're unclear, you can look for somebody like me. So, one of your resources can be Postpartum Support International. Postpartum Support International is the guru. They help people all over the world. They have online support groups and trainings for healthcare providers like myself to learn the specialized things that we need to know to help recommend medications for moms. Aiza, I see your question. Thank you for another question. Please talk about drinking coffee while pregnant. Can I drink 1 cup of coffee? Thank you for answering. Yes, not a problem, Aiza. And actually, I love that you're asking this question, Aiza. I actually have a video on this. And of course, I'm going to answer your question. But if anybody is interested in like a longer answer, there is a video on it. So the answer is yes. Yes, please, please, please drink your coffee. Okay. There's a lot of different reasons why coffee is villainized. And I'm personally a coffee drinker, so I'm really a big advocate. So first of all, coffee has caffeine. So a lot of people will say, oh, you can't have caffeine, it dehydrates you. There are studies, you will find them, that say coffee dehydrates you. I'm not going to say they're not out there. They're definitely out there. However, there's a lot of studies that debunk that. And here's why. Coffee is made with water. Okay. So yes, caffeine can dehydrate you, but you're replacing that water. So it's kind of a wash. So I'm going to tell you that that's kind of not a thing. But for a lot of pregnant women who get a little nervous because they're like, maybe it's really the other research I should be listening to, what I tell them is drink your cup of coffee with a water chaser. So have your cup and drink 8 ounces of water afterwards. So if you're at all concerned, you're going to cover that dehydration thing. Now let's talk about caffeine. So caffeine is a stimulant, right? But most people, it's just not that strong. Now, when we talk about stimulants, what are the risks of a stimulant? That it might raise your heart rate or it might raise your blood pressure. So if you start getting a whole bunch of palpitations when you're drinking caffeine, you might want to stop. You might have to pull back on that coffee. However, if palpitations don't exist, you're not having any blood pressure issues, and you haven't been told by your healthcare provider not to drink it, you can absolutely drink it. Not that much caffeine goes across the placenta. The final thing I'm going to tell you about that part of it is that caffeine is a medication we use in NICU. For those of you who aren't aware, I have worked in mother baby postpartum. I have worked in labor and delivery. I have worked in high risk antepartum, taking care of pregnant women with medical conditions. And I've worked in NICU, the neonatal ICU. Okay. This is where we take care of babies that are sick or medically fragile or preterm. For the little teeny tiny babies that are born, like the 24 weekers or 25 weekers, we give them caffeine as a medication because it's a stimulant. It stimulates them to breathe. So understand, if we're willing to give caffeine, it literally shows up on the computers, caffeine, to your preterm baby, having a cup of coffee is going to be just fine. Okay. So I really want you to take a look at that and think about that. Now, if you look at caffeine during breastfeeding, it is also safe. Okay. So the thing is that with caffeine during breastfeeding, the biggest thing you have to worry about is that your caffeine will get into your breast milk a little bit. Now, again, it's not a ton of caffeine. It's safe for your baby. However, okay, the caffeine is going to hit your breast milk a couple hours later. So if you drink coffee at 3 o'clock, your breast milk might actually have that caffeine at 6 or 7 o'clock. So now if you're going to feed your baby at 7 o'clock at night, your baby's going to get a little dose of caffeine and is probably going to be awake until 10 o'clock, right? Just like we are. The other thing is if you pump milk, you may want to label that milk, with coffee, right? That way, when you're going to use that milk later on, you can feed the baby that milk, say in the morning. One of the things I do for my moms that are breastfeeding and they take melatonin is I tell them to go ahead and to label the milk that they pump about 3 hours after the melatonin as melatonin milk. And that way they're giving that milk at a time when the baby's supposed to be going to sleep. This way you're not messing up your baby's sleep schedule because of a little bit of stuff in the milk. Okay. So that was a great question, Aiza. And I really think, I'm really glad that you put that in there. So for those of you who happen to be joining us at this time, my name is Dr. Samantha. I am the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time answering your questions live, as well as questions that we receive on our videos. And if you can tell, we've already answered a couple questions from Kyle and from Aiza. And so please do what they did. Put questions into the chat. That's what we're here for. Don't be shy. I'm going to go ahead and answer another question that we had on our videos this week. So we had a couple questions that were placed. We had one question that was placed on our blood pressure video. So it says, "Hello, madam. I'm 35 weeks pregnant and my blood pressure has been elevated since 35 weeks. Sometimes it's 145/90 on a digital blood pressure machine. Should I take medication or should I wait? I already take propranolol 20 in the evening due to severe anxiety." So I love this question. This is one of my most favorite questions to answer, I think, tonight, because I think blood pressure is very misunderstood. Hi, Z. Welcome, welcome. So 145/90 is a not good blood pressure. If you were diagnosed with a 145/90 and you're 20 weeks pregnant, we're going to try to get that number down. Okay, we don't want you to have a high blood pressure because that can lead to preeclampsia. And we have a video on that. Preeclampsia is a life threatening condition that is usually highlighted by one organ failure and high blood pressure. And if left untreated, can lead to seizures. So we want to make sure that we are addressing that very carefully. However, some women will just have high blood pressure during pregnancy, or they'll have pre-existing high blood pressure that they kind of bring into the pregnancy, right? So one of the things you need to know is once your blood pressure has been elevated for a while, the placenta gets used to that. The placenta's blood vessels require a higher pressure pushing the blood through. And if we lower the blood pressure too much, then what can happen is that will actually cause the placenta to not work as well, and it might be bad for the baby. So, this is going to kind of depend on a lot of different factors that your healthcare provider needs to be monitoring. Your healthcare provider should have sent you to a maternal fetal medicine specialist. They're the ones who deal with high blood pressure during pregnancy. They may want to drop your blood pressure just a little bit, but they may also be trying to kind of keep it where it's at because you're so close to the end, and then just monitoring you for signs of preeclampsia. Like I said, we're going to link that into the description, right? Now, the propranolol. For those of you who don't know, propranolol is a beta blocker. So this is a category of blood pressure medications that are designed to not only drop the blood pressure a little bit, but they're also designed to drop the heart rate a little bit. In psychiatry, we can prescribe propranolol for anxiety. So I actually prescribe propranolol all the time. So I'm very, very familiar with this medication. I love this medication. One of the things you may want to ask your healthcare provider is if we can use this to our advantage. So taking 20 milligrams of propranolol at night is totally fine. Propranolol, unfortunately, is not the best medication for blood pressure. So it's probably doing a little bit of something, but not a lot. I would ask your healthcare provider if you can possibly take 20 in the morning still. Now, you can't do that off of my advice. In psychiatry, we prescribe no more than 20 milligrams, but it is safe for pregnancy. And possibly they could give you 20 and 20, and that might help your blood pressure issues to get you to that 39 weeks when they can deliver you. All right. So I'm going to go ahead and answer another question that we had. We had a question about pacifiers. And this is actually not a question. It was a comment from a dad, but I really liked it. So it said, thank you so much for this video. It was very helpful for me as a new father. It's the second night, 1:30 a.m., and the baby hasn't given mom any rest. She's been latching on to mom great, and her weight gain is good. So I've decided to ask for a pacifier just for a few hours so mom can rest. I was nervous about whether we should do this, but after seeing this video had described my exact situation, I'm so grateful we did give her a pacifier. Thanks again. So I wanted to bring this comment to you guys because pacifier use is extremely controversial. So pacifiers are recommended by the American Academy of Pediatrics once breastfeeding has been established, which is usually around 2 weeks old. And this is because this pacifier use during sleep helps reduce the risk of SIDS, sudden infant death syndrome. So pacifier use is not evil. Now, one of the things that you're going to hear a lot of people say is the words nipple confusion. And the reason why a whole bunch of lactation consultants and nurses and doctors will say don't use a pacifier in the hospital is because it's going to confuse the baby's latch and they're going to have trouble breastfeeding. So for those of you who don't know, I am an international board certified lactation consultant for over a decade. This is something that I have done regularly. And as I told you before, I've worked in NICU. One of the things that happens in the neonatal ICU is that we have to give babies pacifiers. These babies are going through a lot, and sucking on a pacifier helps to soothe them. It's a natural reflex that babies have. These babies in the NICU, they go from pacifiers to tube feedings to bottle feedings to breastfeedings and all sorts of stuff. And honestly, they do a very good job. Babies are very adaptable and they can learn to switch from one nipple to another as long as you're using the proper techniques. Now, what this dad was referring to in his comment was the baby's second night, which I believe, have a video on and we can link. But the baby's second night is the night where the milk hasn't come in yet and the baby is just constantly wanting to eat. Baby's very irritable, baby's very upset. And so mom can be breastfeeding for 4 hours straight and she can get exhausted. I can't tell you how many times in my career I have given a family a pacifier just for an hour. Just an hour's worth of sleep can help a mom get enough rest so she doesn't get formula. Now, understand, formula is not evil. I have plenty of videos that talk about my absolute wonderful praises of formula. I think it's fantastic. I think however you want to feed is fantastic. But I know a lot of you are going to have the goal of breastfeeding, and I know that second night is hard. And sometimes using a pacifier for an hour can make such a huge difference in your breastfeeding success. So I want you guys to know that it's okay. Now, what happens if the baby doesn't latch? Guess what? You don't use a pacifier for a couple days. You sit and you work with the baby. The baby will latch again. It will happen. Just maybe it'll take a couple extra minutes. That's it. Just you go with the flow, you keep going. I promise you, babies are very adaptable and they can figure it out. So that pacifier question or pacifier comment was like amazing and I loved it. Okay, so I have a question on UTIs. My urinalysis shows bacteria, trace leukocyte asteris, but no nitrates. Is this a negative or mild UTI? So what is a UTI? UTIs are urinary tract infections. They are extremely serious and it needs to be addressed during pregnancy. Hey, Karen, I will answer your question next. So UTIs can cause miscarriage, preterm birth, and stillbirth if they're left untreated. This is because a urinary tract infection can turn into a systemic infection called sepsis. And the way this happens is you have the bladder, okay? So the bladder is attached to the outside by the vagina by the urethra. The urethra is a very short tube that leads up to the bladder. And for women, the thing is we have a lot of natural bacteria down in the vaginal area. And if we don't wipe properly, that bacteria can travel up into the bladder. Now, when you're pregnant, your baby sits on the bladder compressing it. It's very hard for you to constantly completely empty your bladder. And as a result, some of that bacteria sits there and the urine becomes infected. Now, the best treatment is antibiotics. And so when we have certain symptoms like frequency, burning pain, a smell to the urine, we want to test your urine. And if we see certain traits like nitrates, like leukocyte asteris, which is like white blood cells, and bacteria, those are signs with the symptoms that we have a urinary tract infection and we need to treat that. Now, if left untreated, what happens is that bacteria goes from your bladder up the ureters to the kidneys. And the kidneys are where, if this gets infected, this is filtering blood. In case you guys didn't know, your kidneys filter blood. So if you get bacteria in here, that bacteria causes pyelonephritis, which is a kidney infection, and it goes into the blood causing sepsis. So this is why it's so important to treat it. So this patient is saying, is it a negative urine or a mild UTI because there's no nitrates? Nitrates are one of the things that we usually see. The answer I tell you is that's a urinary tract infection, not a mild. I don't believe in mild urinary tract infections. For those of you who are like, whoa, what is she talking about? So you guys are going to read a lot of stuff online that says you can treat urinary tract infections homeopathically. I fundamentally disagree. Okay, once that bacteria is established, that is a serious concern. Now, the thing is, we oftentimes, when we refer to this, we can treat naturally. We are thinking about a woman, a human being who is not pregnant. We need to separate the two. Pregnant women are immunocompromised, and that's very important for you guys to understand. That means your immune system is not going to be able to fight off stuff like bacterial infections and virus infections like everybody else. Is it possible for you to flush your system of bacteria that's colonized into the bladder? Absolutely. I'm sure if you drink enough fluids and everything, then you can flush that out. But a pregnant mom does not have the time to waste with this. And most antibiotics are completely safe during your pregnancy. So it's far better for you to go ahead and get treated. Now, one other thing that a lot of people ask about is cranberry juice. And cranberry juice has been proven to not treat urinary tract infections. So this is like an old wives' tale that if you drink enough cranberry juice, that you're going to be able to treat your urinary tract infection. It will not do that. However, if you are prone to urinary tract infections, what they have found is cranberry juice can reduce the risk of developing one. This happens because it makes the urine acidic, and the acidic content of the urine prevents bacteria from growing there. So that's where cranberry juice is helpful. Cranberry juice is helpful to prevent, but not to treat. So for this person, I would say you have a urinary tract infection. Make sure you get treated. All right, Karen, can you please tell me if it's normal to feel my belly a little numb, my belly button feels sensitive, and my feet are swollen and a little numb too? I'm 38 weeks pregnant. And for a mom, how come she has to be induced sometimes? Okay, two very good questions. All right, so the numb belly, little tricky, okay? Your belly can get numb towards the end because the belly's been stretched so far. So a lot of women, they get stretched and your skin will get taut and shiny, and it's just like as tight as it can be. And that can make the belly button sensitive, and it can make you feel a little numb. It's kind of like a neuropathy. So it can happen, okay? However, the swelling in the feet is a concerning thing, especially with the numbness. So swelling in the feet with a little bit of like pins and needles could be the signs of preeclampsia. So one of the things is you want to call your healthcare provider and let them know, because if you are developing preeclampsia, that can go really wrong really fast, and it can become a very serious issue. Okay. So what are some of the other signs of preeclampsia? For starters, you might get headaches. Okay. If you're getting headaches, this is a very serious sign. You want to get that checked out. The next thing is eye disturbances. Okay. So eye disturbances can include floaters or things that you see coming across your eyes, spots. You can see flashes of light. You can see like a narrowing of the light. You can see all sorts of stuff. Okay. And so those are things that you want to make sure that you're looking out for. Okay. And then finally, if you get pain on the upper right side of your abdomen, like right under the breast. Okay. So that pain might be a dull pain or an achy pain. It will usually be constant. A lot of moms will mistake it for heartburn, and they'll think it's heartburn, but then it's like a little different, so they're not sure. If you have that kind of pain, you need to tell your healthcare provider. And those are 3 potential signs that you are like developing preeclampsia, and you want to get it checked out. Okay. And the swelling feet is one of the biggest things that I'm honing in on. Okay. So I realize, Kyle, sorry, I see that the question for how come a mom has to be induced is from you. So that's a good question. There's a lot of reasons why moms will have to be induced. For starters, if you're having certain medical complications, you might need to have an induction. That can include preeclampsia. That can include complications from diabetes. For others, if you're post-date, so if you're after 40 weeks pregnant, that's one of the reasons why we will induce you, because we don't want to let the baby stay in there too long. Another will be if the baby is too large. So if a baby is too large, there are risks that the baby may not be able to come through the vaginal canal and through the pelvis, and that can lead to a medical emergency. So that's a very common reason. Unfortunately, I can't tell you that there's like definitive criteria, because moms get induced for a variety of reasons. It's a very complex kind of decision-making process that goes into it. At least here in the United States, we're no longer inducing women before 39 weeks unless we absolutely have to, because there's a lot of data that shows that babies born prior to 39 weeks have a lot of different like complications. So that is one thing that we tend to not do that beforehand. But it's one of those things that you really just, you have to kind of see what your doctor is saying. And you want to let them know that you want to hear about the risks versus benefits of why they're asking for you to be induced, so you can make an informed decision. For those of you who are joining us, my name's Dr. Samantha. Please feel free to put some of your questions into the chat so that we can answer them live while we're all here. So we got a question on my sex and pregnancy video. I'm 2 months pregnant and sometimes I have cramps after having sex, especially when we do doggy style. What is causing that? So I love the questions about sex. I think it's very important for us to openly talk about sex during pregnancy and postpartum. This is part of human nature, and it's something that we need to make sure we're doing safely, and we're, everybody is, basically having a good time, and we're able to do this like without anybody, hurting, especially the mom. So with sex, hopefully you're having good sex. And if you're having good sex, that means hopefully you're having an orgasm. So when you have an orgasm, your body releases a hormone called oxytocin. And for a lot of you guys, you may recognize oxytocin because that's also called Pitocin. Pitocin is a medication that we give you during labor to help you contract and help deliver your baby. We also give it to you after labor to help prevent a postpartum hemorrhage. So that oxytocin, it causes contractions, just like it would do during labor. That's the cramping that you're feeling. So those uterine contractions happen due to that release when you have the orgasm. And so you'll have some cramping. It's completely safe unless you're having a pregnancy complication. So just so you know, a healthy sex life is totally fine during your pregnancy unless you've been directed otherwise by your healthcare provider. And one of the things I encourage you guys to do is sometimes a doctor will tell you you can't have anything in the vagina. They'll say nothing in the vagina. You should always ask if that means you can't have an orgasm, because a lot of women may not be able to have penetrative sex, but they can still have external stimulation and have orgasms. The other thing I want you guys to understand is sex can cause some bleeding during pregnancy. The tissues in the vagina, they thin out because of the hormones that sustain your pregnancy. And so as a result, sometimes you'll get these little tears, and those tears can cause some spotting, which is normal, but you do want to check in with your healthcare provider and make sure everything's okay. I love that you're going to call your doctor, Karen. Okay, so if you guys can't see it, Karen's saying that she doesn't have any other symptoms, but she's going to call her doctor and let them know because it's her first pregnancy and everything is new. I love that. Guys, your healthcare provider is on call 24/7. They signed up for this job. I find a lot of moms are hesitant to call. They feel embarrassed, they don't know, or they're afraid to go to the hospital every time. They're not sure if they peed or if their water broke. Please let us check you out. Okay? It's nothing we haven't seen before. It's nothing to be embarrassed about. This is our job. This is their job. Okay? We all want the best for you and the best for your baby. And it's very easy for us to check you out. Listen, when you're at the end of your pregnancy, you're going to pee on yourself sometimes. It happens, okay? And that's because you got a lot of pressure going on down there, right? And so sometimes you don't know if your water broke. I mean, water breaking is not that big gush everybody talks about. In fact, for a lot of people, it's just a dribble. But if you don't address your water, your amniotic sac being broken, you can actually get an infection, and that could be bad for you and the baby. Instead, just go in. If it's pee, we'll just tell you it's pee. We'll all laugh it off and you go home. And if you pee every single night, well, guess what? We're going to check you every single night, and it's not going to be a big deal because we're going to know that your baby is doing well because we're going to listen to your baby while you're there. So please, please, please do what Karen's doing. If you're not sure, ask, call them. This is what they're there for. And yes, it is hard work to deliver a baby for sure, but hopefully you have a good support system around you, a good community to help you out. Oh, I see, Kyle, yours was one of the questions on the VBAC. Oh, Kyle, I'm going back to your question. I'm sorry, I didn't realize that. So Kyle, you had asked your question about the 40 weeks on the VBAC. So VBAC stands for vaginal birth after cesarean section. So I want to make sure I address that part. You can have a VBAC at 40 weeks or 41 weeks. The gestational age has nothing to do with whether you're allowed to have a VBAC. VBACs, and please guys, feel free to look at my video. There's a lot of nuance and a lot of details to this question. But if you've met all the criteria, you have the right incisions, your pregnancy is low risk, you're a good candidate, just because you've reached 40 weeks does not mean you're not eligible. Also, Kyle, just because you might need an induction, because I know you asked earlier about an induction, even if you need an induction, you can still have a VBAC, okay? The biggest reasons why a VBAC wouldn't be allowed is if you have some kind of risk factor, or more importantly, the wrong incision from a previous C-section that would put you at risk for a uterine rupture. Okay, so those are the biggest risk factors. So I had a question on the dilation video. It was, I'm 37 weeks today and scheduled to deliver in 4 days, but I've been 2 centimeters dilated and 70% effaced for 2 months, and the mucus plug has come out in pieces. So I think she was just trying to see like what was going to happen, and like, was she in preterm labor? Was she dilating? So let's talk about dilation. Okay. So you have a uterus and you have a cervix. So the cervix is at the bottom of the uterus. Okay. Now the cervix, right? It's supposed to be, let me do it that way. Long, thick, and closed. Okay, this is what your cervix really looks like on the inside. And believe it or not, it kind of feels like fingers. So we want it to be long and thick and closed, but you can see the cervix has to open to let a baby's head come through, right? So it does have kind of like this slit, and inside that slit is where the mucus plug is. So it's just basically a line of mucus. It's designed to help prevent bacteria to go up into the uterus, which could cause an infection. As the cervix dilates, that mucus plug falls out. Now, for some people, it falls out in like this big glob. Some people, it's little tiny bits, and you don't really notice it. Okay. Now, 2 centimeters dilated. So 2 centimeters dilated is about like this, kind of like this wide. Okay. And it's hard for us to describe, but we go from 0 to 10. So 2 centimeters, we're 1/5 of the way there, 20%. Now, 2 centimeters means you're a little open. It does not mean you're in preterm labor at all. Okay. There are many moms who've had 2 or 3 babies that will sit at 4 centimeters for months and they'll be totally fine. Everybody's different. It just means that your cervix is kind of getting ready. Now, the last thing she said was 70% effaced. So what does that mean? Okay. So you have your thick, long cervix, and you start to have contractions. And what happens with this cervix is over time, it thins out and then moves up to allow the baby to come down. So this process right here, where it thins out like that, that's effacement, okay? And what we want is 100%, which basically means it's gone. It's just gone. So 70% means you're almost all the way there. That's an excellent sign. It means you're getting close. And so it probably means that if you get induced, it's going to be easier for your induction to work because you're most of the way there. So just so you know, those are some of the things that we see as far as like when we're talking about dilation. Okay. Now, I want any of you guys who have any questions, please feel free to put them into the chat. So we had a couple other questions about bleeding. One of them was, I'm 6 weeks pregnant. On Sunday, I started to have light pink spotting. The next day, I went to my OB to get a transvaginal ultrasound. We saw our baby has a fetal heart rate at 101. However, that Monday, I'm still spotting. The OB says she does not know what's causing the bleeding. She ruled out ectopic pregnancy and subchorionic hemorrhage. She mentioned there's a likelihood of a miscarriage. It is currently Wednesday, and my bleeding is increasing with clots, which is similar to a period, especially when I use the bathroom to urinate. It still does not soak a pad, but I'm really worried. I'm having slight cramps this morning that went away after an hour. No other symptoms. Since we've confirmed and saw our baby's heart rate, if I continue to bleed, what are the chances the pregnancy is going to go to full term? So this is a very hard question to answer. So can I tell you the chances? Unfortunately, I can't. I can tell you that there are women who bleed very heavily all 9 months and they have perfectly healthy babies. There are women who spot once and have a miscarriage. Bleeding is very subjective and it really is complex because we don't know always what causes it, and therefore we can't always answer the question. One of the things that I'm going to tell you is in this mom's experience, and it was so nice for her, it was really brave and nice for her to share this, is that she is showing signs that this is accelerating. The bleeding's getting heavier. She's having clots, which are little pieces of blood. The likelihood this is a miscarriage. Okay. Why this happened, it's hard to say. We now know that miscarriage is a lot more common than we used to think it was. And miscarriage often happens when our bodies sense a pregnancy that isn't healthy, that's not going to be good for us, and is not going to be compatible with life. And I know this is a hard concept to talk about, but I think it's important that we talk about this stuff. Not every baby is able to live outside of a belly. If there's severe genetic abnormalities, this might mean that lungs don't develop or brain doesn't develop, and that's not a baby that can survive. If our body senses that, our body is going to try to force a miscarriage. The reason for that is our body is designed to protect us first. So in the early stages, our body is looking to make sure we do not maintain a pregnancy that could hurt us, because every time we're pregnant, there is some risk for us. Once the pregnancy is established, your body's going to do everything it can to protect the baby, because now it's trying to do its best to keep that going. So one of the things you can do if you're suspecting a miscarriage. So in this case, she did everything right. You went to the doctor, you got your ultrasound, but now there's a little bit more issues going on. You need to ask for a blood test. So when we're testing the urine for a pregnancy, we're checking for human chorionic gonadotropin, HCG levels. If there's HCG in the urine, your pregnancy test shows up positive. The problem with a urine test when we think a miscarriage is happening is you will still have HCG in your system, so you may show up as positive, and this may give false hope. So instead, what's good is to get the blood test. So when we get the blood test, what we're doing is we're testing the blood for HCG. What you need to do is get a blood test and then 3 days later have it repeated. If your levels are rising, that means the pregnancy is sustaining itself, and that's a good sign. And if your levels are dropping, that means that you're most likely having a miscarriage. It's important for us to know this and for you to know this so we can treat it accordingly. Because if you are still bleeding, but your HCG levels are going up, we want to make sure you're not becoming anemic. We want to make sure you're well hydrated, and we want to make sure we keep assessing you so that the outcomes for your pregnancy are good. Okay. So that was an excellent question. So I think that that's it for tonight. Nope, I'm sorry. I have one more. I'm currently 5 to 6 weeks pregnant. Today around 12 p.m., I began to get light bleeding while I experienced white discharge. Should I be concerned? That came from Simone. That's a really good question. So white discharge could be a yeast infection. Okay. Yeast infections, we have a video on that. We'll link that into the description. But yeast infections, if left untreated, can cause they can cause preterm birth, they can cause miscarriage, they can cause stillbirth. It's just like any other infection. One of the things a yeast infection can also do is it can cause the vaginal tissue to be very, very irritated. Your vagina might burn, it might itch. It's really uncomfortable. And so because the tissue is so irritated, sometimes you'll bleed a little bit. And so that could be where that bleeding is coming from. So in this case, especially since you said it's like pink spotting, well, no matter what, you see any blood, you call your healthcare provider. Please, please, please. But in this case, because she is seeing that also white discharge, you definitely want to make sure you get checked out to see if it is a yeast infection. All right, guys. So I am Dr. Samantha, the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time to answer all of your questions live. We also answer any questions that you asked on the videos this week. So I'm really glad that you're here. I love interacting with you. Excuse me. And I love getting a chance to answer all your questions. We are also on Facebook, Instagram, and Twitter, so please follow us over there. We will link those in the description. Share the channel with your friends and family. Please like and subscribe. It really, really helps me out. And you want to hit the notifications button so you can get notified of our latest content. And now here's the sneak peek that I was telling you guys about. I think tomorrow's video is going to be fantastic. For those of you who are wondering, tomorrow's video is going to be on birth plans and the things that you should include and the things that maybe you should not include. So please, please, please check that video out tomorrow. I am so glad you're here. I am Dr. Samantha, the maternity mentor. Bye for now.